mentioned, my name is Dr. Victor Valcalasco. I'm a professor of oncology at Johns Hopkins University School of Medicine, where I'm the co-director of cancer biology at the Sidney Kimmel Comprehensive Cancer Center. I'm also on the board of directors of the American Association of Cancer Research. I'm here today to speak about the health implications of the proposed mulching operations in the residential area of Dayton. It is clear from the medical literature that industrial wood waste recycling processes result in the generation of wood fragments or mulch that have a number of inherent dangers, and you've heard about some of them already. But what I'd like to do now is to focus on the health hazards, and you'll hear next actually from another speaker that'll talk about the effects that have already occurred in our communities. So the primary hazards from industrial mulch processing are increased exposure to infectious agents such as fungi and bacteria, and respiratory and cancer-related effects of wood dust. Although we often think of wood fragments as something natural, the amount, type, and storage of materials that are generated in an industrial mulch facility are no longer on the scale that we would encounter naturally or that are inherently safe. These are not theoretical risks. I have shared with you in my testimony, which you have, a recent example of a healthy retired gentleman that developed fungal pneumonia after exposure to mulch. He developed kidney injury and failure and died of infections months later. It was clear that the fungal spores from mulch were the root of infection, and there are dozens of reports in literature and from throughout the world that are related to infectious agents in mulch, primarily, as I mentioned, fungi and bacteria. Fungal spores can travel distances on the order of miles and are a particular risk to immune-compromised individuals, including children and the elderly. The second clear health risk is from exposure to wood dust. The CDC, or Centers for Disease Control, has documented that wood dust particles are associated with a variety of health effects, including dermatologic effects, allergic respiratory effects, including asthma, and mucosal and non-allergic respiratory effects, including bronchitis, irritation, bleeding, and obstruction, as well as coughing, wheezing, sinusitis, and prolonged colds. However, the health effect that is of most concern to me has been categorized by the World Health Organization and the CDC that wood dust is a carcinogen. The CDC states, the association between exposure to wood dust and various forms of cancer has been explored in many studies in many countries, and the World Health Organization indicates wood dust causes cancer of the nasal cavity and occurs in nasal sinuses and the nasopharynx. It is carcinogenic to humans. There are literally hundreds of papers in medical literature that document the increased risk of wood dust for nasal cancer, lung cancers, Hodgkin's lymphoma, and potentially other kinds of cancers. Carcinogens, by definition, increase the risk of cancer, especially to those exposed over long periods of time. Dayton is a residential community where there are a large number of children and many residents that spend a significant amount of time outdoors and would be directly exposed to the health risks I've described. And of course, many residents plan to live here for many years, potentially their entire lives. To allow exposure to infectious and carcinogenic agents of this type of facility is, in my opinion, and from a health perspective, not to be in the public interest. This would make Dayton the equivalent of a petri dish for health experimentation. Given this and other testimony, I'd urge members of the Howard Council to support legislation that would limit this type of industrial mulching operations to industrial areas and prevent them from occurring on farming, agricultural, conservation, and residential areas like those of Dayton. Thank you very much.
I'd like to talk about the situation in Woodbine, Maryland, where there's been a wood mulch processing facility operating for several years. What I was able to do is Mrs. Leslie Long had obtained consolidated 17 requests for inspections of the Oak Ridge farms. What I did is I sorted through those 17 and I was able to divide them up into approximately 9, well, about half, which were specifically health-related mentioned items versus another 8. And what I decided to do, since the requests had addresses in them, what I did is I mapped all those on a Google Map Earth, and the yellow ones are inspection requests that specifically mentioned health issues, and the brown ones were just general complaints. What was striking about this was that they followed a prevailing wind pattern. From west going to the southeast. The top half of the graph, which is where the majority of the clusters are, there aren't any further than that because that's primarily all farmland. But it's a strikingly strong correlation. What we did then is, between Leslie and I, we did a follow-up phone calls with individuals that had pointed out that there were health issues and did an inquiry about what specifically were those issues. We had cases of chronic sinusitis, so a person that claimed that they had flu for months, which is not characteristic of flu, maybe 2 weeks at most. That's probably more consistent with the mycotoxins from fungal spores. Gentlemen that had a very serious and rapid degradation of the respiratory abilities. A couple of people were found wood particulates in their nasal cavities. Use of respiratory masks that was directed by their ENT. And also a couple of patients that had both nasal polyps and polyps of the throat that were identified. These are significant items. They all relate to the dangers of inhaling wood dust and fungal spores. The nasal polyps and the polyps of the throats are particularly disturbing to me because they can be preceding possible cancer.
Thank you very much. We have
My name is Bonnie Kissinger Beecraft. We have a 100-acre farm, and we also have a 60-acre farm where we live. This is within the mile of this new mulch place that's been going on. I moved out to this area to breathe fresh air and grow my own vegetables in my backyard. And I don't know, in the last 2 years, I've been doing nothing but getting sick. In fact, I had surgery this morning, and I'm here tonight. I'm a little woozy still from the anesthesia, but it has a lot to do with what I'm breathing, and I just hope that they can find out everything that's wrong and give me a reason why all of a sudden, after 20 some odd years, that all of a sudden I'm just going downhill real fast. And I really do hope that there is a solution to this somehow. Thank you.
My name is Leslie Dahl. My farm is downwind in a lower elevation from the mulch manufacturer's Oak Ridge. My husband and I have developed sinusitis and other respiratory issues from particulate matter by aerosols emitted from this mulch operation. This is what our physician, a sinus specialist from the #1 hospital in the country following oncology, recommends. We remove ourselves from the contaminated environment. We use a HEPA filter purifier when indoors. Wear this N95 mask when outdoors. Every time we come indoors after being outdoors, we irrigate our sinuses with a saline rinse with the Mulch sinus rinse system. You fill the bottle, you squeeze it in one nostril till it runs out the other. And you take it, squeeze it on the other nostril till it runs out the other. Then you sniff it back, and that irrigates your sinus. That gets rid of the wood particulate matter that comes off that mulching operation. The other thing is we have to use a variety of nasal sprays and be prepared to take steroids and antibiotics, all with many side effects. The Oak Ridge mulch manufacturing operation has greatly decreased our quality of life. Many times from the neighbors I hear these phrases: I'm tired of being sick, I was never sick until this mulch started, I just wanted to stop, this is killing me. People's response to endotoxins, mold spores, and bioaerosols will vary. Some will be more susceptible based on the concentration of exposure, immune response, sensitivity, pre-existing medical conditions, and other factors. Those who are immunocompromised, on chemo, or have asthma are particularly vulnerable. Several of the mulch manufacturers here tonight are probably going to try to convince you to allow industrial mulch processing on other than expensive and one's own land. In my opinion, you're about to be greenwashed tonight. Greenwashing is the practice of making products seem more environmentally friendly than they really are. Don't get fooled by these living manufacturers of natural wood waste recycling.
Hi, my name is Donna Owens. I was one of those yellow dots you all saw earlier in the presentation. These are my medical records starting back from 4 years ago. I have gone through thyroid surgery. I've had cancer removed recently again. Nobody in my family's ever had thyroid problems on my mother or my father's side. When I went to my radiation doctor, the first question was, could this be caused by my smoking? And my doctor at Shady Grove said, no, this was environmental. Whatever you all do, you're going to do, it's making people sick. My next door neighbor has gotten sick. They're getting ready to move. People in my neighborhood are getting ready to move. We live there. We love picking at Larryland. But this dust is killing us. Please, please think about it. Thank you.